Centre for Workforce Intelligence exists to help the health and social care sector to forward plan to provide secure workforce into the long-term future. We create intelligence that helps people to make better informed decisions around workforce planning. Some of the past failures of workforce planning have been because people quite naturally look to the immediate future, 1 year for this year's budget, 2 years, 3 years possibly for forward budgeting. But actually what's necessary is to look 10, 15 and even 20 years ahead so that you can make much better informed plans. And what we do is try to get some of those scenarios developed and then look at the probable futures and narrow it down and put some numbers around that so that we can model it in order to ensure a secure workforce supply for the future. The key people in delivering social care currently in local authorities are clearly the top table of adult social services. So the delegates to this conference are in a pivotal position to influence and change the way that we deliver the services of the future. And I expect that most of the delegates here are themselves thinking about, well, what is it that we might do differently? What are the new ways of working that we might consider? And what are the options and what are the relative merits of those options? So I hope that those delegates are able to take some of what we're offering to influence part of their thinking and come out with a solution that's better for all, and most particularly the people that use the services. A lot of people are worried about the future, and a lot of people are thinking, with austerity, financial problems and so on, how are we going to manoeuvre through all of this? Actually, it has potential opportunities for radical rethinking around ways of delivering services, great new innovation and new partnerships, new people coming together in order to deliver services. And that's part of what the Centre is doing, is acting as a catalyst and a facilitator for encouraging people to come in and work together collaboratively and in a collegiate way. We're really pleased that over 80 authorities at the last count had downloaded and are using our social care model. We spent a lot of time in development in partnership with local authorities and others in social care to arrive at that model, and we're pleased that it's actually starting to pay dividends in helping them to deliver their workforce. We're very pleased that we've revamped the CfWI website and have produced a number of innovations and made it more interactive, introducing new modules, new content and new ways of manoeuvring and filtering so that you get exactly what you want. You have to bear in mind that we cover health, social care and public health, and we want people from each of those constituencies to want to come back to our site, and the evidence is they're coming back and in big numbers.